So for patients that are about to undergo aquablation surgery, the workup typically includes questions and answers, physical exam, PSA testing, flow rates. And what I explain to them about their preoperative and postoperative care, we have to manage any anticoagulation blood medicines before the surgery. They can't be anticoagulated at the time of the operation, with the exception of maybe perhaps low-dose 81 milligram aspirin. Postoperatively, they can expect to have an observation stay in the hospital. That's because the special type of catheter that they're wearing allows for us to irrigate in from a bag of saline and then out to the drainage bag, which helps prevent any clotting of the blood in the bladder in the immediate postoperative period. The length of observation can vary from a few hours, where patients go home the same day that the operation was performed. Some of them will spend a night or perhaps even 2 nights. That's determined by how much bleeding is going on and how their recovery is going. They can expect to wear their catheter afterwards from 2 to 7 days. Patients that have a catheter in their bladder before the surgery tend to wear the catheter after the aquablation surgery for longer. And one of the nice things about aquablation surgery is for patients that are sexually active and they wish to maintain antegrade ejaculation, so that's the fluid that comes out from the penis when they have their orgasm, aquablation has less than a 10% risk that that will be altered, or what we call retrograde ejaculation, which is not a significant medical problem, but some patients don't like the look or the feel of that retrograde ejaculation. So aquablation's become a very salient choice for those patients where maintaining antegrade ejaculation is important to them. Now, after the actual procedure is performed, I ask that they refrain from any strenuous activities, which would include sexual activities, for 10 to 14 days. I always encourage them to walk immediately after surgery, and in fact, they're up and walking on the day of surgery, because that does not fall into the strenuous category. But any kind of lifting, golf, tennis, those are the sorts of activities that they can expect to delay for 2 weeks. Bicycle riding, particularly road bicycle riding, because of the pressure on the prostate, is usually one that it's more like a 6 or 8 week period. And that's usually when they feel comfortable sitting on that seat again, which typically is 6 to 8 weeks, just because of the amount of pressure that puts on the prostate itself. At home in those first couple of days, men will have blood in their urine that will be on and off. We really try to have them encourage oral hydration as best possible to keep that urine color as light as possible. They can also expect to see some scabs in the first couple of days, or clots that will come down and through the catheter. And then once the catheter is removed, typically about 10 to 14 days after the aquablation, there'll be another rush of scabs or clots that come off on that channel that's been created in the prostate urethra. Otherwise, there typically can be expected to be seen a couple of days after the operation to have the catheter removed in the office, and then I will usually see them back in about 8 weeks after the surgery has been performed. They do go home from the hospital, typically with antibiotics for 5 days, and a medicine that usually will help soothe the urethra, because once the catheter comes out, they can experience a little bit of burning. Other than that, it's been a great operation, an easy recovery, and one that I'm very happy to be able to offer.
For additional videos and information, visit foreriverurology.com or maineurologysupport.org.